Hi, my name's Gareth Dobson and my HLA project was on burnout in medical trainees. I decided to undertake this project following reading a relatively recent GMC survey which identified that a quarter of UK doctors had experienced burnout at some point throughout their training. Not only has burnout been demonstrated to have a negative impact on doctors themselves, it's also been shown to have an impact on patient satisfaction and the quality of care provided. Having worked within the health service for several years now, I've personally seen colleagues suffering from burnout, with some of these unfortunately deciding to leave the profession as a result. I believe that raising the understanding of burnout and the awareness of available local support services for trainees will have a positive impact on doctor and patient satisfaction as well as staff retention. My aims were to assess the current level of burnout in foundation trainees, review the current available support, and implement a foundation teaching session into the curriculum to raise awareness of burnout. I used a business model canvas to plan the key aspects of the project and created a Gantt chart to support the execution of my project. I directly contacted key individuals within the trust, obtaining buy-in from them using my refined elevator pitch. I created a burnout questionnaire based on the Copenhagen Burnout Inventory and distributed this to foundation trainees within the trust. In addition, I also reviewed the current foundation teaching sessions to assess whether topics such as burnout and well-being were covered. I successfully developed connections with key individuals, including those responsible for coordinating the foundation trainees, a safe working guardian, and a colleague who has undertaken similar work within the consultant cohort. One noticeable success has been the opportunity to undertake further leadership roles following the networking I've performed. My project has not been without challenges. Undertaking full-time surgical training, various other projects, and new fatherhood made balancing the workload and orchestrating meetings challenging at times. In addition to this, COVID-19 also unfortunately impacted on some of the initial project deadlines. Another difficulty was met when one key individual was not initially supportive of the project. However, by using other colleagues as a sounding board, I was able to overcome this challenge and regain confidence in the project. I have now distributed the burnout questionnaires to the local foundation trainees within the trust. I'm in the process of collecting and compiling the results and aim to implement the planned teaching sessions following the collation of these results, as this will allow a more targeted session to be delivered. My plan going forward is to deliver the foundation training sessions and collect feedback on the intervention with the hope of extending this to other trainees within the region. Thank you for listening.